Now that I'm a week post-op, I'm going to talk about what you need for top surgery. So before I went into surgery, months before I went into surgery, I started immediately asking different groups of people that I knew, and trans individuals, GNC individuals who had had top surgery, what they needed for their post-op. I talked to my surgeon about it. I did further research, checked out YouTube, and then pretty much made a list. And even with that list, there are certain things that were not brought up to me. So what I'm going to tell you right now, things that you need for top surgery, meaning what you need for day of to 2 weeks worth of recovery. I'm speaking on knowledge from being about halfway through my recovery. I'm talking about a list of things that some things I just forgot and couldn't have imagined, neither did other people. So hopefully this is a more comprehensive list. So things that you need. Number one, this is not tangible. You're going to need to mentally prepare yourself for surgery and for post-op. The reason why I say this is it goes past being 1,000% sure that you want this surgery. Have you had surgery before? Getting a plan together for that anxiety, working yourself through the realities, being really realistic but positive about this surgery, what it means for you, working out emotionally how you could be feeling after, things that you can do to prevent, certain aspects of depression or anxiety in post-op. Especially if you're like me and you already have anxiety and depression, you want to make sure you have plans in action, because you're not going to be able to do a lot of things for yourself, especially the first week. I've been doing nothing for myself. It's extremely exciting and exhilarating and wonderful, but there's a lot of anxiety, especially beforehand. There's a lot of issues with insurance. There are a lot of things to deal with, just emotion. And it's very draining physically and emotionally, so you just want to make sure you're prepared for that. In terms of things that are tangible, I'll literally start listing them off. You're going to want button downs. As many button downs as you can. If you're in summer like me, you're going to want as many short sleeves as you can. Obviously, if it's colder, you're going to want long sleeves or 3/4 length. The reason why you need button downs is because it is impossible to get yourself dressed, and you can't lift your arms more than how my arms are right now, so you can't get clothes over your head. You're going to probably be stuck in them for a couple weeks, so you might as well get ones that you kind of like at least. I just went to the thrift store and bought a whole bunch. Some of them are a little bit nicer in case you go out to celebrate when you're feeling better in week 2. You're going to want basically full clothes that are very simple in terms of pants that are very comfortable, or shorts that are very comfortable to either lay around in or when you feel well enough to go outside. I honestly have been basically in underwear and an open shirt, if that, throughout this entire week, just because it's so hard for me to go to the restroom by myself because I can't pull down my pants and stuff. So, you're pretty much going to be laying around as naked as possible. And, you'd think that it would really bother you. My dysphoria has been existent, but you're just so tired and happy from the surgery that you care less. You'll find ways to just keep yourself covered and know it's temporary. You're going to want a husband pillow, that big pillow with the big backing and the sort of arms, because you're not going to be able to sleep on anything but your back, and you're going to want to be sitting up a lot and perched up a lot for a couple weeks, potentially 6 weeks. You're going to want just a lot of pillows in general, just because you're going to want to keep your arms as level as possible. They're going to get sore. They'll be sore off the bat. You're just going to want pillows around, keeping yourself elevated. especially if you're laying down for a lot of hours, do try to get up and moving so you don't have clots. But if you're in bed like for a nap or overnight, try to keep your legs a little elevated, maybe a pillow or two. You're gonna want, all your meds. Basically, you're not gonna be able to shower until your drains are out, but you are gonna want simple things that will keep you clean because you can have sponge baths. So I would recommend having washcloths, which is something nobody had mentioned to me or I had thought of. You're going to want dry shampoo. Here, actually, I'll show you what I have. I just used this today. Chlorine. I don't know, hopefully you can read that. And yeah, my hair looks a lot cleaner than it did, not oily. Speaking of hair, you're gonna wanna get a haircut and a shave. Definitely. As close to before your surgery date as possible. I went the day before. I got my hair cut really short in a way that I don't have to put product or do anything to it, or if I did want somebody to style it, it would be really simple and also just really easy to clean. You might have issues brushing your teeth. I certainly have. So we have these oral brush-ups. They're great. You just have somebody use 2 of them. They slip right on the finger, and obviously they're disposable, but they actually work pretty well. I have sanitizer. For entertainment, you're really not going to be able to use your arms at all the first week, at least. So I brought coloring books, but I totally can't color. I've pretty much been sleeping and watching Netflix, so make sure you've got Hulu, Netflix, movies, shows. Later on, you might be able to hold or read books, or if you have like a stand that you can put a book on so you don't have to hold it. Music, certainly. Definitely make sure in terms of food that you have things, especially if you can't have a lot of people with you or you don't have the means to get delivery. You're gonna want things that are frozen, already made, or fresh, already made that you can just heat up really fast. I would say you're gonna want very light utensils, pretty much the lightest that you can think of. I haven't even been able to use utensils. Get, crap, what's it called? Crap, I can't remember the rest of the day. There are like different vitamins and things that you can take for bruising. So you're gonna wanna grab onto maybe some of those, decide what you like. I've heard that vitamin E stains your clothes, so I haven't gone with that. You're gonna want a stool softener. Sorry to get very real with you, but especially if you're gonna go with narcotics or the anesthesia alone, you're gonna wanna make sure you've got that on board. That's pretty much everything.